Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Edo government records poor vaccination figures despite efforts to increase vaccination drive. Taraba government fails to capture COVID-19 in 2022 budget, asks residents not to panic. And UK's health minister says COVID-19 measures are set to be scaled back by next week. Thank you for joining us on the program. According to the World Health Organization, every variant of the COVID-19 virus, including Omicron, can cause severe disease, death, further virus mutations, and jeopardize the effectiveness of the tools we have to fight it. Meantime, in order to streamline COVID-19 vaccination data and address observations made by states and local government areas, this is in terms of capturing the vaccination data, the National Primary Healthcare Development Agency and its partners have revised the framework to evaluate performance of states. In a statement today, the agency says the data that will be presented by state and local government on COVID-19 vaccination will be cumulative data from March 2021 to March 2022. It says the focus will be on all COVID-19 vaccination activities that have been conducted across phase 1, 2, 3 of the mass vaccination campaign. Here's more on the pandemic update.
249 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 14 states and the FCT. That's a drop from the figures reported earlier. Lagos accounted for the highest number of cases with 59 infections. Adamawa had 46, Imo 37, FCT 30, Kwara 14, Rivers 13, while Kaduna registered 10 cases. Taraba, Cross River, Bauchi, Niger, Delta, Ogun, Nasarawa and Kano states logged a single-digit infection. The total confirmed cases in Nigeria now stands at 251,178. The report also includes a backlog of confirmed cases from Adamawa, Taraba, and Niger State as backlog of discharges from Taraba, Imo, and Adamawa, and the FCT, as well as 0 cases from Plateau, Ondo, and Osun states. 577 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 224,629. There were 7 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,110. Currently, there are over 23,000 active cases in Nigeria, while more than 3.9 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 16,000 positive samples, followed by the FCT and Oyo State. More than 12 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 5 million of the population have been fully vaccinated. The total global confirmed cases have surpassed 330 million, while deaths are beyond 5.5 million.
And to Edo State, the government has lamented the poor COVID-19 vaccination rates recorded so far. According to these statistics, only 5% of residents have received their jabs. The executive director of the National Primary Healthcare Development Agency disclosed this during a stakeholders meeting on increasing vaccination uptake for a healthier Edo State in the state capital.
COVID-19 vaccination is in progress at the premises of the Edo State Hospital's Management Board. Chief Osato Bazwaye is no stranger to this exercise. In fact, he is here to receive his booster dose.
So like I'm not saying I'm immune, that I now have bulletproof on COVID. No. If I contract it, the effect will be very minimal.
This is an ideal case for the Edo State government's drive to get at least 60% of residents vaccinated. In reality, it's a far cry from the expected vaccination figures as illustrated in this stakeholders meeting, less than 100 meters from the vaccination point.
That is close to 1,100 people turned out positive from this test.
The health experts here confirm that the worrying statistics on the impact of the coronavirus is a further testament to the potency of COVID-19 vaccines.
In every 100 persons who have tested in the past 1 week, at least 3 persons tested positive. And among them, we have up to 94% of them, close to 94% of them unvaccinated. That is to tell us the level of work we still need to do.
The state government says it is a long way off the projected vaccination figures.
Now, in this mass vaccination campaign, we are expected to vaccinate 50% of our eligible population, amounting to 1.3 million plus. And we have only vaccinated 62,000 plus, which is 5%. This is quite small. Looking at the statistics, it's not encouraging.
The Edo State government insists that getting residents to take the vaccines is a task that must be achieved, as the figures will improve the COVID-19 figures in the state.
Use that same hand without washing them.
Meanwhile, the World Health Organization is in active partnership with the Edo State government to intensify efforts at controlling the spread of COVID-19 in the state. To this end, a COVID-19 continuum of care review meeting has been created to bring all stakeholders in charge of prevention, testing, home-based care, isolation, treatment and vaccination under the same umbrella for better efficiency.
Oyo State continues in its determined bid to fight the COVID-19 pandemic. This time, it's bringing together officials in charge of vaccination in the state and representatives of the World Health Organization for a continuum of care review meeting to stem the spread of the virus.
Before now, the primary health care board has been in charge of vaccination, while the the response for COVID-19 has been in the purview of the EOC. But now the Edo State government is bringing together this platform that we call COVID-19 continuum of care, from prevention to testing to those that will be in charge of care, even at the isolation centers, to vaccination, so that there can be a platform for all these health workers to interact and deliberate. So we call it COVID-19 continuum of care.
The Primary Healthcare Board, who is in charge of vaccination, brings us up to speed on the latest vaccination statistics in Oyo State.
We've been able to vaccinate well over 600,000 individuals in the state with 2 doses of infection. Then we are now going to the third phase of the event, which is the booster dose, which we are giving to people that have received their 2 doses. So by and large, our exercise has been so commendable. The acceptance is impressive.
Some of the participants present lauded the initiative as one that will encourage seamless cooperation among all the agencies involved.
Having all these stakeholders, all the actors, when it comes to prevention and also care. Now we are at the point where people are being mobilized to take the COVID-19 vaccines. So there are, stakeholders responsible at the LGA level and at the state level who are responsible for ensuring that people get the vaccines and they also get the first dose, the second dose, and we have the data.
The COVID-19 Continuum of Care Review meeting is the first of such aimed at eliminating the bottlenecks associated with the treatment and management of COVID-19 in Oyo State.
And Dr. Akiela Ishaku, a virologist, joins us now for more on the program. Thank you for joining us.
Thank you for having me.
All right, I'd like to begin with last night's figures. Almost 300 cases. Are we coming out of the 4th wave, do you think?
Yeah, Melissa, I think we should not actually rejoice that we are coming out of the pandemic, because we need to equate the number of positive cases to the number of samples that we have tested. I can categorically tell you that in January, we have not tested enough samples that a lot of states are not even, testing. So I strongly believe that for us to establish that the number of positive cases or the seropositivity rate is dropping, it depends on the number of tests that we actually undertake. I think we need to encourage states to do testing, and by and large, that will be when we will establish that the number of cases are dropping.
In terms of vaccination, we have states like Edo says it has expanded vaccination sites, yet still registering very low uptake. We have states like Nasarawa that is leading, and that's the first dose about 51%, followed by Jigawa and a few southwest states. What do you think is still the big problem here with people coming to take their vaccine? And this is also taking the first dose and completing it as well before the booster jabs.
Yeah, I think kudos to Nasarawa State. That's my state. Melin said I'm from Nasarawa State, and we did significantly well. What necessitated Nasarawa State doing well is because a lot of stakeholders, buying into this. A lot of faith-based organization, a lot of community leaders, ethnic leaders bought into the campaign. The reason why you see a lot of states are still struggling with COVID-19 vaccine is because of the associated fake news and then misinformation that came with the vaccine. And I think that what we just need to do more is to actually step up our advocacy, our risk communication component, and then have a coordinated stakeholders involvement. In Abuja now, for you to enter into any government facility, you must present a COVID-19 vaccination card. And I think that even today, I was barred from entering into the office because I left my vaccination card at home. I have to drive back to get my vaccination card, and then before I got entry. So I think coming up with policies of no vaccination card, no entry into any big, plazas, big corporate institutions and organizations, that will go a long way to increase the vaccine uptake. But, Nigerians also bypassed most of these protocols. There are people that even borrowed cards from people. So government must also think of, having a security around ensuring that people must take, vaccines before, attending public functions and also getting into public offices.
We also understand that, in some places there are also apps that prevent that. But I want to quickly ask you the final question, and this is on herbal solutions for COVID-19. I know that there were a number of people who felt that there were some natural things that could be taken, to sort of distance themselves from getting COVID. Are you a believer of such, and does it in any way help keep the virus at bay?
Sorry, can you come again?
In terms of herbal solutions to COVID-19.
Yes. So
do you actually feel that there is truth that some herbs can prevent one from contacting the virus?
Absolutely. NAFDAC approved certain herbal drugs this January 2022 for the treatment of COVID. Those drugs have gone through a lot of efficacy validation tests. And for NAFDAC to say that such kind of drugs are okay, I think as a country, we can give it a trial. Why not we promote the made in Nigerian drugs and then to see how we can also encourage our scientists. But I'm also glad to share with you that FDA has approved 3 antiviral drugs for the treatment of COVID. But I think that we just, as a country, just need to go into small clinical trials into the approved herbal medicine, and then to see whether it is very efficacious. We can do that in our isolation centers and even for people that are positive. But I think that I want to suggest that we don't have the component, we did not approve the policy of self-testing. And I think that NCDC and, steering committee, presidential steering committee should be able to come up with an algorithm for self-testing. Let us encourage people to do self-testing using the rapid diagnostic kits. Once we do that, we can be able to nip this in the books.
It would also be good to hear what
NAFDAC
NAFDAC has to say, especially on, the herbal solutions to COVID-19, if indeed there are any. But we appreciate your time. We'll have to leave it there at this time. Thank you so much, Akiela Ishaku, a virologist. Many thanks for joining us on the program.
Thank you for having me.
Well, we have the global update of the COVID-19 pandemic and other stories when we return. Please stay with us. Welcome back. Taraba State is urging residents not to panic or develop fear regarding the outbreak of the COVID-19 Omicron variant or its inability to capture the pandemic in the 2022 budget estimate. The government says it has met the other two arms of government and machineries have been put in place to serve as shock absorbers. Speaking during the 2022 budget breakdown in Jalingo, the Permanent Secretary, Ministry of Budget and Planning, disclosed that what led to health workers embarking on strike last year will not repeat itself this year, as all the loopholes have been catered for.
I want to assure you that we have taken all the necessary requirements that are supposed to be done to ensure that that is not repeated. And just like my Honorable Commissioner has said, Nigerian cares particularly, let me come back to that, is COVID-19 action, recovery, and economy stimulus program put together by the World Bank to ensure that the effects of COVID-19 is taken care of by the various implementing agencies. I want to also add that we're not even looking at the issue of financial autonomy. We are looking at the sister, or what we call executive, legislature, and judiciary. And so when they brought a very strong case that, yes, the issue of autonomy might be there, but we also look at that all the resources, even though it is the executive that is either producing and developing their project and budget for them, they have equal standing status.
Away from Nigeria, Number 10 is drawing up plans to phase out England's remaining pandemic restrictions from as early as March, as Prime Minister Boris Johnson signals to his backbenchers that he is prepared to let the UK leave with the virus. A senior source confirms that the government was looking at ending mandatory self-isolation for positive COVID cases, saying it would be perverse to keep the measure in the long term. The legal requirement to self-isolate carries fines of up to £10,000 for non-compliance and is one of the several pieces of COVID legislation due to expire in March, and the government is considering whether any of it will still be necessary. Meanwhile, Britain's unemployment rate dropped late last year before the onset of the Omicron coronavirus variant that has since shaken the economy, and this is according to today's official data. Well, joining us to take a look at the situation in England, Dr. Essian Ukorobi, GP Registrar, Worcester Royal Hospital, England. Thank you for joining us on the programme.
Thank you very much.
So over the weekend, the UK says it's drawing up plans under which people will not be legally bound to self-isolate after catching COVID-19. I mean, what does this mean, especially for the UK?
In the last few days, we've heard the Prime Minister and essentially the UK government say that they are reviewing plans to remove restrictions that were in place for the COVID-19, of which one of them was the compulsory self-isolation of everyone who has tested positive, to COVID-19. And that isolation period is considered to be not effective at the moment. And come March, it should be taken out. At the moment, it is mandatory. It is a government regulation. And as you correctly said, there is a fine of up to £10,000 for people who defy that rule. But what it means moving forward is that we will get to a point where people would no longer be bound by these rules, but we would have what the government calls some government guidance, where people then take the decision whether or not to self-isolate after testing positive for COVID-19. So that simply means that I could test positive for COVID-19 today and I decide to go into work tomorrow. That's what it means. And of course, the other side of it is that we will then have lots of positive cases mixing with, should I call it, negative cases, and we stand a risk of another surge in cases should this happen. But of course, we can't tell, and we believe the Prime Minister is working with advice by scientists, but that's the plan at the moment.
Dr. Korobi, some scientists are warning against downgrading the laws to reduce the spread, saying, it could hit pressure on the NHS. Yes?
Yeah, that's absolutely true. It is a valid concern by scientists because it is a risk that the government is preparing to take come March. And as you know, with risk, it can actually go either way. So it can turn out fantastic and be a good plan. But of course, it can also, backfire and take us back to square one. And we understand and we appreciate that the plan B, which the government set up previously, which involved, of course, wearing face masks, social distancing, working from home and self-isolation, has shown some success. As we've seen in the last couple of weeks, that there's been a 50% reduction in terms of infection rate and hospitalization. I believe these are the figures that the government is working with at this time. But of course, it is a risk, and there are lots of uncertainties surrounding this decision. Uncertainties like new mutations, so possibilities of new mutations like the Omicron coming up again, possibilities of more virulent viruses or variants of this virus, possibilities of a surge, of course, in positive cases in the country if these restrictions are completely removed. And of course, this would then lead to a pressure in the NHS and doctors and nurses and health workers struggling again. These are the concerns that the scientists have. And that's why they say it's important to review this and see if this is the right time to actually, take off all of these measures.
Also, Mr. Johnson, facing the greatest pressure of his premiership, if we would call it that, over the Downing Street party scandal, essentially, how have people been reacting to it? And do you think that this would also keep people in terms of, whatever rules or measures the Prime Minister comes up with in future, that they will really listen to him?
Without going into much political detail, it is clear that rules were broken at that time by the Prime Minister himself, who set down these rules. And of course, these issues are still under investigation as we speak. But I think, people are tired of, getting leaders give them rules. And of course, the leaders don't live by these rules. We've seen, a couple of top government officials here in the UK resign for not following their own rules. And I think that's why the Prime Minister at this point is facing a lot of heat and people calling for him to resign because he set rules that he, in fact, himself did not follow. But I would say that whatever comes from the government, I think the people would follow it.
We appreciate your time always on the programme. Dr. Akiela Ishaku is the GP Registrar with Worcester Royal Hospital, England. Thank you for joining us today.
Thank you, Millicent.
Australia today recorded its deadliest day of the coronavirus pandemic, with a total of 77 deaths, up from the previous national high of 57 on Thursday last week. The country is dealing with its worst COVID-19 outbreak, fueled by the Omicron variant. Here's more on the Global Update.
Global Update continues with China's mainland administering more than 2.94 billion COVID-19 vaccine doses as of Monday. According to data released by the National Health Commission, the mainland has reported 171 new COVID-19 cases on Monday, including 127 locally transmitted and 44 imported cases. In the UK, the health authorities are optimistic that the COVID-19 measures introduced to reduce the spread of Omicron will be scaled back next week as cases and hospitalizations look to have peaked. Prime Minister Boris Johnson introduced the so-called Plan B measure for England in December in a bid to slow the spread of Omicron. The measures, which include advice to work from home where possible, greater mask wearing and the use of vaccine passes, are due to be reviewed on January 25th.
The action that this government has taken in response to Omicron and the collective efforts of the British people have seen us become the most boosted country in Europe, the most tested country in Europe, and the most antivirals per head in Europe.
Israel is continuing to offer a fourth COVID-19 vaccine shot, despite preliminary findings that it's not enough to prevent Omicron infections. A preliminary study published by the country's Sheba Medical Center on Monday found that the fourth shot increased antibodies to even higher levels than the third, but it's probably not enough to stop the highly transmissible Omicron variant. Israel was the fastest country to roll out vaccinations a year ago.
Well, our website has more updates and a better understanding of the pandemic. You can also find other stories, breaking news at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.